I Hate the News is the weekly news bulletin from I Hate Politics podcast, a show about a human activity we love to hate. I'm Sunil Dasgupta. It's June 23rd, 2026, primary day in the state of Maryland. If you haven't voted yet, this is your last chance to affect the outcome in this cycle. You'll be able to vote again in November, but in many races across the state, whoever wins the Democratic primary will likely prevail in the general elections. The primary is your real election. Go vote. Last week, the Federal District Court of Maryland denied a federal lawsuit to compel the state of Maryland to disclose the unredacted version of the state's voter database. Maryland is one of 30 states where the Trump administration is seeking to examine voter rolls, presumably to try to find discrepancies. The federal government has issued new work requirement rules for Medicaid enrollees and thrown states in another round of tizzy. Maryland's Office of the People's Counsel is asking the state's Public Service Commission to reject all but $15 million out of Pepco's $120 million rate increase proposal. And as we begin the summer, a reminder about Maryland's lists of noxious and invasive plants and more. Stay with us. I Hate Politics is a podcast about our neighborhoods, workplaces, schools and streets, and our local governments as they function in diverse and democratic societies. This means our politics are messy, dirty, sometimes corrupt, with often self-serving politicians. But no matter how much we may hate politics, we are never exempt from it, even when we refuse to participate. In fact, the purpose of politics is to keep society functioning precisely when we don't agree with each other, like now. Music for this episode comes from Baltimore-based musician Seth Kibel's newest album, Clarinet Without A Net. Marcel Penzies on trombone, Simone Barron on accordion, Tara Linhart on mandolin, Elliot Seppa double bass, Haroon Alam tabla, and Seth Kibel himself on the clarinet. Jeff Gruber at Blue House Productions in Silver Spring recorded, mixed, and mastered the album. One of the Trump administration's biggest political arguments is that voter rolls in Democratic states are not accurate, and this is cause of electoral fraud. Using civil rights language, Trump's Department of Justice has sought to access state voter rolls for the purpose of ensuring the accuracy and currency of official lists of eligible voters. Maryland is one of 30 states to reject that demand. While Maryland's Democratic leaders believe this is political fishing and possibly a way to inject chaos into the state's electoral process, State Attorney General Anthony Brown, in his response, called the database request legally insufficient. The Justice Department, he said, had provided no basis for its demand, neglecting to articulate why it believed a federal election law had been violated, and it provided an inadequate purpose, failing to connect its demand to concerns about disenfranchisement through racial discrimination. Last week, the Federal District Court of Maryland returned an opinion to deny the Trump Department of Justice its request for access to the state's voter rolls, or at least would not compel the state of Maryland to disclose the unredacted voter rolls. The opinion said that the Justice Department's argument was not supported by cited case law, and the request would lead to conflicting readings of the Civil Rights Act and the National Voter Registration Act of 1993 and the Help America Vote Act of 2002. In more election news, Maryland may yet go through its redistricting efforts, which it had struggled with through the spring. State Senate President Bill Ferguson is rumored to have softened his stance against redistricting. I imagine the primary results would determine the final decision. The 2025 One Big Beautiful Bill mandated work requirements for Medicaid enrollees. Not for everyone, but for about 20 million people nationwide, 325,000 of them in the state of Maryland. Since then, states have been trying to build out the infrastructure and processes that connect health and employment records so they can comply with the new law when it goes into effect January 1st, 2027. This month, June 2026, the Center for Medicare and Medicaid Services, the agency that manages Medicaid, sent guidance that enrollees must meet work requirements if they do not have significant medical impairments. No definition of what that might mean. The new standard has thrown states, including Maryland, into a tizzy trying to figure out the transition. Morgan Henderson is a senior director of analytics and research at the Hilltop Institute at UMBC, which assists the Maryland Department of Health figure out these issues.
The Medicaid work requirement applies not to all Medicaid enrollees. This applies to individuals in the what's called the Affordable Care Act adult expansion. Basically, those individuals that gained Medicaid eligibility by virtue of Medicaid expansions from the Affordable Care Act about 12, 13 years ago. And big picture, these are basically childless adults with incomes up to 138% of federal poverty level. So before the ACA, to get Medicaid, you had to be basically a kid or a very, very low income parent or caretaker. We're talking a couple $1,000s a year in income. And so this ACA expansion, it expanded eligibility up to 138% federal poverty level. Still pretty low, about $22,000 a year for a single person. And so these people, typically childless adults, they're not disabled, they're just low income. Now this group, they're going to have to comply with the work requirements. They have to do one of two things. Either they have to meet the hours requirement, which means working for at least 80 hours a month, or you can volunteer or do community service for that number of hours, or be in a work training program, or be enrolled in an educational program at least half time. However, some people are going to get exempted from having to comply. And so there are about 10 different groups of these individuals. And so if you are pregnant or postpartum, if you have a young child at home under the age 13 or under, or crucially, if you're quote unquote medically frail.
What about seniors?
This only applies to folks aged 19 to 64. 65 and above doesn't apply to you. If you're 63, it may apply to you. The big one, though, and this was the big surprise, this is the thing that's causing a lot of consternation, is this definition of medical frailty. In the statutory language, there are 5 domains of folks who can be medically frail. You either have to be blind or disabled, or you have a substance use disorder, or you have a disabling mental disorder, or you have a physical or developmental disability, or you have a quote unquote serious or complex medical condition.
Who certifies that?
That's what there's so much debate about right now. Let's say you already are in Medicaid. You could use an algorithm to just check your medical history. How many doctor's visits have you had? Have you had any inpatient hospitalizations, ER visits, and then for what diagnoses? So states had done a lot of work getting these processes set up. The rule, which just came out, it actually adds a layer. It says you have to be in one of these 5 domains, and you have to be significantly impaired in your ability to comply with the work requirements. CMS, they've said in the regulation, they're not going to release a standardized definition of that can be just uniformly implemented. That's not going to happen. So states have to come up with their own. There's been nothing. I think the AMA released something saying they would maybe work on it, but there's been nothing that states could use.
One of the biggest problems government, right, has in providing services is this issue of targeting correctly. One of the ways in which programs become quickly delegitimized is because their targeting is faulty. Governments almost always prefer targeting broadly rather than narrowly because they know that they are very limited in how they can target. We see the same thing with welfare, SNAP benefits, or whatever else. I mean, everywhere, when you target too narrowly, you have these edge cases that people point to. They imply that there is corruption involved as a consequence of not being able to target well. And so then those programs come under immediate political pushback. Are we headed in that direction?
Medicaid has been characterized by expansion since inception in 1965. And now we're big contraction. And this is a really big contraction. I've never seen the likes of this contraction before.
This is likely to leave lots of people out of coverage. Mm-hmm. What happens to those people?
Well, no one really knows how many are going to lose coverage. In Maryland, the total population of the ACA adults, 325,000. Unknown and unknown how many will lose coverage because of this. You cannot get advanced premium tax credits for marketplace coverage. That's in the regs. You can buy a policy on marketplace. You're going to be paying sticker price. No APTC for you. Hopefully, nothing bad happens. You don't get hit by a bus. But if you do, you go to the hospital. Of course you do. And the hospitals will treat you. They have to. Hospitals' uncompensated care costs are going to rise because of this. Now, there are certain ways for hospitals to mitigate that. There is something called hospital presumptive eligibility, where hospitals can make a snap determination. Hey, does this person seem to be Medicaid eligible? If so, get them on Medicaid, sign them up then and there. And so then the hospital gets covered and we'll get that Medicaid reimbursement.
How can that happen if there's work requirement?
I know. This is the HPE. It's not widely used anymore since the ACA. And I think it will kind of get revived, this hospital presumptive eligibility Medicaid pathway. It will probably get revived to a certain extent. Now, there is a source of exception for the work requirements that is short-term hardship. And one of those is you go to the hospital. Okay, so this makes sense on the face of it. Sunil gets hit by a bus. Sunil goes to a hospital. All of a sudden, poof, Sunil is eligible for Medicaid. The hospital can get paid. Great. Problem is, my reading of the reg is that Sunil has to go to the hospital last month, and then he becomes eligible for Medicaid this month. We're still parsing the details of this, but it's been a very challenging 2 weeks, and I think it's going to continue to be challenging several months as these things get figured out.
Morgan Henderson, thank you. Please come back when you know more.
Will do.
One of the biggest issues this election cycle is the cost of living, and electricity rates are right in the middle of that debate. Pepco, the local electric utility in the Washington suburbs of Maryland and in D.C. itself, has asked the state's Public Service Commission for a rate increase that aggregates to $120 million. The Maryland's People's Counsel has filed a counter saying that the Public Service Commission should disallow as much as $105 million of Pepco's rate increase request. David Lapp is Maryland's People's Counsel. He explains.
Of the $105 million less that we are saying that Pepco should be authorized to increase rates, approximately $75 million are attributable to its cost of the profits, which is the regulatory set return on equity. Most of that results from a reduction in the return on equity from Pepco's request of 10.5% to our recommendation based on objective factors to 7.7%. A portion of that, just over $75 million, is attributable to a change in what we call the equity ratio, and that's the amount of equity versus the amount of debt, which is adopted by the commission as a fiction based on their request, because Pepco does not issue stock itself. It's all done through its holding company, Exelon. So that's about $75 million, a little over $75 million. About $8 million is for a reduction related to the White Flint substation that we think the commission should deny recovery of that 180 million in capital expenditures in total. A little over 11 million is for plant closings, and those are for projects that have not been entirely complete and are not used and useful for customers at the time of the rate case. Another almost 8 million are reductions in operating costs. Another slightly less than 6 million is the removal of costs related to a tax adjustment. That tax adjustment would increase its rate base by a total of about $50 million, but the effect on the annual revenues that Pepco is asking for to serve customers is about $6 million. And then there's about a little over 5 million that are related to income tax and other adjustments and offsets. And that brings you to a rate increase of a little over 14 million as opposed to Pepco's 120 million approximately.
Usually, operating and maintenance costs are a pass-through, dollar for dollar. But here you're making the claim that they're asking for more than they should get. What is that argument?
Well, some of that relates to adjustments that they're asking for related to projections of future employment that don't reflect the actual number of employees that they have during the test period that we use to calculate rates. Other parts are related to inflation adjustments and what we call corrective maintenance work. So there's several different buckets where we think that Pepco's costs for operations and maintenance are too high.
Can you explain what a test period is in this context?
Under standard rate-making practices that have been used to set utility rates for at least a century, and most recently in Maryland, all the way up through 2020, before the commission adopted its multi-year rate plan, which sets rates based on future projections. Under standard rate making, rates are set based on actual utility spending and costs. And so the utility files a rate case. As part of that rate case, they designate a 1-year period, and it's called the test year. And rates are set based on costs for that year.
Is there a difference between the Public Service Commission mandated rate of return and what they are telling investors, and that rate of return is different?
When a utility raises capital to fund infrastructure, it's a combination of debt and equity. And equity is what we argue about in rate cases and what the regulators set for utility monopolies. The cost of debt, we don't argue about in rate cases because, it is part of a rate case, but we don't argue about it because it is what it is. But one of the big factors in setting the utility's overall rate of return, which is a combination of equity and debt, is how much is equity and how much is debt. When Pepco files its application, it proposes a structure, a capital structure of so much debt and so much equity that is fiction, because it's not issuing any equity. It's getting all the equity from Exelon, the holding company. Exelon as a company has less equity and more debt than Pepco is proposing to the commission. The better way to do it is to take Exelon's capital structure and apply it to the utility, because that's a real number and you're not having to make it up. And that is also being applied to reduced capital investments that we are recommending to the commission. For example, the White Flint substation, we are recommending that the commission disallow the cost of that substation. The commission in the last rate case told Pepco that it needs to quote, thoroughly justify its decision in a later prudence review. And Pepco did not come close to meeting that burden in this case. We're always asking the question, does this work need to be done now? Right?
Normally, when an entity is working on projected numbers, there is a reconciliation that is done after the fact. And following that reconciliation, money will go one way or the other. Does that happen with utilities?
Generally speaking, no. There is no reconciliation. Once a rate is approved, there's a prohibition in utility law against retroactive rate making. That's the challenge we have with approving, capital expenditures before they're needed.
David Lapp, thank you for taking the time to explain the People's Counsel's request to reduce Pepco's rate case request.
Thanks for having me.
It's summertime and the lush green woods and forests bring us joy and hope. But look closer and a lot of the verdant are invasive species. Montgomery County recently banned new bamboo plantings, which is an invasive. Maryland maintains 2 lists of no-no plants, one for noxious weeds and the other for invasives. If you don't know Kathy Jentz, you should. She writes the blog and hosts the podcast Garden DC. And she is always my first stop whenever I have questions about plants.
Those 2 lists are from the state of Maryland, plants that are either affecting agriculture or natural systems, meaning our wildlife areas. Those can be invasive plants that are threatening a dairy because some of those noxious weeds, if the cows might ingest them, that can get into the milk and that could be poisonous, right? So that's a true noxious weed. I think we all agree on that. And then invasive plants and natural systems could be pushing out our native plants. They could be displacing things. They could be doing actual harm by taking down some of our old growth trees.
Invasive means it comes from elsewhere. Are the noxious weeds local or are they coming from somewhere? Are they also invasive? What is,
Yeah, so they can also be invasive, but there are some noxious weeds that are native. A good example, Sunil, would be poison ivy. Poison ivy is great in a wildlife area. Birds love the berries and the seeds. There's no problem with poison ivy. But if it's in the back of a recreation center, a schoolyard, it's going to be considered a noxious weed right there.
And the invasives are shattercane, Johnson grass. Are those the invasives?
Yeah, so those can be some of the invasives, and usually it's something, again, that might taint milk, or if you have a field, say, of grains, and it's mixed in with your grain, and you don't want that mixed in with your wheat or corn. It could have detrimental effects to whoever the consumer is, a human or livestock, then that's a noxious weed, of course.
And do you know which ones are the biggest problems in the state of Maryland, Mid-Atlantic generally?
Canada thistle is a big one. That is a notorious reseeder. And then I was thinking of anything with a milky sap, like that when you cut it with a blade, exudes that latex.
Mm-hmm.
That's usually a problem too in farm work and agriculture too. The amaranth is really getting to be an issue. There's different forms of amaranth, right? So we have good amaranth, the grain that you want to eat. And that's why I think they were starting to grow it. But it has become so invasive that it's just like outcompeting some of the crops that they want to grow. So now they're finding amaranth popping up everywhere.
Where is it coming from?
So in that case, the amaranth was introduced. It might have been a cover crop, or it might have been a crop that you did in between or at the edge of a field. And it's just such a prolific reseeder. It goes crazy. A lot of our noxious weeds or invasive plants we introduced, we as in humans and industry, for a purpose. So, the famous kudzu that ate the South, the vine that ate the South, was introduced during the Dust Bowl era for erosion control to hold in soil. And it did a great job of that. It was a perfect one. And it's an edible weed. And so it just was too successful when it came and was introduced to our growing areas. Same thing with, there's a lot of different Asian vines that we've introduced. And of course, the classic case of bamboos, right? So people planted bamboo at the back of their property because it's a fast spreading, it is a grass, but a fast spreading grass with underground roots. So you would have an almost immediate privacy fence. So compare planting 5-10 pots of bamboo with putting in a privacy fence. That's a no-brainer, right, Sunil? Who wouldn't do that? But they weren't thinking that generations down the road, that running bamboo is now taking over the world.
Yeah, I mean, my neighbor has bamboo and it's constantly coming under the fence. Mm-hmm. And there is nothing that I can do. Every month I'm going out there cutting up, what I can see and then trying to take out the roots, but absolutely fighting a losing battle.
Take your cup of coffee out there in the morning, in the springtime, and just stomp all the new shoots that are tender and easy to get, and you can kind of maintain the line that way.
So you can just stomp them? You don't need to cut them?
Correct. You can just stomp on them. Huh. So every time you see a new shoot pop up, just stomp on it. And again, you just have to keep maintaining that line. It's the owner after you, Sunil, who doesn't maintain that line, and then it's another 5 feet, another 10 feet.
Montgomery County banned bamboo recently. How are we going to enforce that?
That was my question too. When Evan Glass was considering the law, what they came up with was commercial sale of invasive running bamboo is prohibited. But if you currently have it, and that's what the main people I heard from, Sunil, was panicked people in my garden club who have like a huge swath, a backside of running bamboo. They moved in their house in the 1960s. They're now senior citizens. They cannot physically dig this out, right? So they were freaked out that they were going to be fined by this bamboo. So now it's a matter of it just can't be introduced new, and what's there has to be controlled. There was going to be a component, and I'm not sure, Sunil, if this passed, that if once you sold the property, that it would trigger a replacement is necessary for that bamboo. So you wouldn't be able to sell your property currently with bamboo on it.
I was on a boat on the Anacostia recently, and the banks are entirely taken over by kudzu. It really seems that these lists and things that states have are not working.
Yeah, so part of it is controlling what's currently there. Every down county elementary school I visit, usually there's a playground and then there's a slope down or a slope up. Those have kudzu. And how does every elementary school but no other property have kudzu? You could just do the math and figure out it's usually the mow and blow crews not cleaning their equipment between jobs. So if you come to one job site and you mow over to kudzu and hack it back, but then you go to your next job site and you don't clean your equipment before you work on that new work site, then you are not going to be helping the problem. You are actually spreading the problem.
What else are there big offenders?
The worst to me is lesser celandine. That is a spring blooming plant that's in almost every Montgomery County park that I visit. It has a lot of lookalikes, but it basically is a low-growing ground cover that has such a thick root system, this little knotted root system, that it outcompetes a lot of our native ephemerals and kind of just mows right over them, just runs right over them. It has like a yellow, almost daisy-like flower. So again, somebody sees it in a park, they might go, to a local park and see a whole swath of it by the stream bed. How pretty all those yellow flowers are. Dig it up and bring it home. And again, that needs education because they didn't know that in 5 or 10 years, their entire backyard is now going to be that lesser celandine. And the saddest part, Sunil, is deer hate it. Deer won't eat it. Same thing with the kudzu. Deer aren't eating the kudzu. If they were, we would have a lot more control of a lot of these invasive plants.
If I see the lesser celandine, what do I do?
Just make sure you're not bringing any home, like not tracking. If it's in the part of its growing cycle where it's going to seed, you could step on it or in the mud and collect the seeds and have them on your shoes. So just clean it off, any mud off your shoes before you come home. But also talk to the local parks authority, maybe the friends of whatever park it is, and ask them, are they aware of the lesser celandine in that area, and are they combating it?
What about Norway maple?
Mm-hmm.
That seems like a big problem too.
Yeah, that one has those helicopters, right? That we call it the little helicopter seed capsules. So it's a prolific reseeder. It's not that it's not it's a decent street tree. It was promoted, I think, in the 50s and 60s because it had good pollution resistance, has gorgeous fall color. It's not a bad tree in and of itself. It's the fact that it reseeds so prolifically that you're going to have thousands of tiny little Norway maple seedlings, and it's outcompeting a lot of our other trees.
Which local plants are most affected?
It's usually the spring ephemerals. So I'm thinking like Virginia bluebell, right? So if you have a whole stream valley that's been colonized by the lesser celandine, your crop, we'll call it, that is going to come up that spring of your Virginia bluebells is probably gone. We have spring beauty that also blooms about the same time as lesser celandine. That's another one that's getting completely run over. And I'm seeing in the park near me, Sunil, Jessup Blair Park, which is on Eastern and Georgia on the DC Maryland border. They had a beautiful field of spring beauty for the last several years. And more lesser celandine is taking over that field. So it's really sad to see.
It seems that the state enforces these lists mainly at point of sale.
Mm-hmm.
Are you satisfied with the nurseries and what they're doing?
I'm a member of MNGLA, which is the Maryland Nursery Growers Landscape Association. So those are the growers and sellers of landscape plants. And they are very, very well aware and cooperative with the Maryland Prohibited Invasive Plant List. There is a phase out period of 2 years.
Are there differences between, say, Virginia, Pennsylvania, Delaware?
We do have little eco regions. I'd always say that plants don't look at a map, though, Sunil. So each of our states and jurisdictions has its own invasive list. There's a lot of overlap, right? And there's ones that are being considered for the Maryland Prohibited Invasive List that have already been declared in Virginia and Pennsylvania, and vice versa.
Why have these many lists? Why not have a common list?
From region to region, if you look at Western Maryland, once you pass the mountain, that's a whole different thing. They are a different zone. They might be USDA Zone 5, and we're 7 here. And then same thing on the Eastern Shore. They're much warmer. They're much different growing climate. So really the line, Sunil, is the fault line is 95, pretty much runs along 95. And there's the coastal plain to the east of it and the mountain region to that side.
Kathy, Jens, thank you very much.
Thank you, Sunil.
That's all for this episode of I Hit Politics, where we aim to stem the decline in local news by working with community voices. Don't forget to tune in to our Tuesday morning news analysis. I Hit Politics is produced by me, Sunil Dasgupta. Music for this episode comes from Baltimore-based musician Seth Kibel's newest album, Clarinet Without A Net. Marcel Penzies on trombone, Simone Barron on accordion, Tara Linhart on mandolin, Elliot Seppa double bass, Haroon Alam tabla, and Seth Kibel himself on the clarinet. Jeff Gruber at Blue House Productions in Silver Spring recorded, mixed, and mastered the album. If you want to share your music on the show or know someone else who might want to, please email producer@ihppod.org. I hope you'll subscribe and share the podcast as we bring you stories about politics close to you and to your home. See you next time.